hard to breathe, grab a beverage or two. We got professional guests with lots of stories for you. So take a seat right here and join us on Careers Over Beers.
Welcome to Careers Over Beers podcast, folks. I said Welcome to Careers Over Beers podcast. I'm the host, Jesse P. Krause, and today I have Mr. Wong on. Tell us about yourself.
Well, I am Erik Wong. I am a medical scribe with Vituity Hospitals in Wichita, Kansas. We work at 3 different campuses: St. Francis downtown, St. Joe on Harry, and then St. Teresa out west.
Cool. And I love having guests on like you because you told me you didn't care what we drink today. You're like, whatever you got.
No preference.
I was like, liquor or beer? You're like, no preference. So this is like one of those clean out episodes where I just get to take all the extra shit that I have left over.
Cheers to that.
So we're drinking Blue Moon.
Never disappoints.
You like Blue Moon?
Oh, yeah. Actually,
for
it's
you.
funny because, our mutual friend got me into beer. I didn't understand it before. I was a big wine guy and never really understood beer. But
Really?
yeah,
There's not much to understand. It's just kind of like a carbonated liquid that gets you good buzz.
I didn't understand that. I guess my only context was like Bud Light or Coors. I was like, oh, it's all one note. But he started introducing me to like Pilsners.
Fancy beers.
Yeah. Craft stuff. Kind of our mutual friend enjoys. So.
Craft beers are kind of blowing up right now. That's kind of the new scene and everything. I still don't mind a trash beer. Bud Light, Busch Light, whatever get you through the day.
Oh, absolutely.
But so you said you're a medical scribe.
Yes, sir.
Tell the world what that means, because I don't even know what that means.
Fair. A lot of people don't. So medical scribes, in the context of medical documentation, we are the ones that assist either the physicians, the NPs, or the PAs in their, just documentation roles. Ever since, I believe it was under President Obama, the electronic medical record went into effect. They have to have electronic records. Before, you would have chicken scratch on pieces of paper, and that would serve as the patient's entire chart. So if one doctor had really poor handwriting and another doctor read it, like, what does this say? Does this say CHF or CAD? What is this abbreviation?
Don't all doctors have very poor handwriting?
I would want to say so, but I met one of them that had like pretty fanciful, like the kind that you would see in a book. I was like, you write prescriptions with this hand? And they made fun of me for that. So.
Yeah, I always kind of assumed it was like a requirement for a doctor to have shitty handwriting.
Oh man, you would literally. It's not a stereotype. It's a true thing. So
scribes didn't used to be a thing back in the day?
No, I mean, my program started in 20. Oh man, my boss would get mad at me. I think our program in the Vituity system started in 2013 or 2014.
Before that, there were no medical scribes?
No, I mean,
really,
it was paper documentation. The doctors were able just to knock out their official documentation in the room with the patient. So. Never before. So kind of with the rise of EMRs or electronic medical records, our position came into effect. And I guess to just generally answer your question, it is just documentation on behalf of a provider. So we go to the patient's room, we hear the story, what they're complaining about or their complaint, and then we go out there, document calls. Really it is a lot of paperwork. I always joke to my new scribes, we get paid to click the buttons. That's pretty much how
Not a bad gig.
No,
right?
not at all.
So you don't actually have to do anything medical then, other than write down what's happening medically.
Exactly. Non-clinical, hands-off. Again, one of the nice things about it is if you have a patient that gets overly rowdy and they're going to charge you, you just get out of the way and say, oh, doctor, whoever, you're going to get tackled because I can't touch the patient, but you can. So I do enjoy that.
So from start to finish of your shift, you're just sitting there taking notes, basically.
Pretty much. I mean, most of us, I know it works differently for the Wesley system, but at Vituity, what we do is most of us take clipboards in with the room and we write, like, hey, patient's having a fever, how high was the fever, when did it start, et cetera, et cetera. A good way to really think about it is we're kind of their second brain. We often remind them, hey, don't forget to check on room 7. You promised them you'd give them results in an hour. Or, hey, can I get patient 8 a blanket? Things like that. So it's kind of like an assistant I would probably say an assistant that is non-clinical in that respect.
Yeah, so basically just an assistant to the doctor or the PA.
Yeah.
Which is a physician's assistant. And how did you ever find out about this? Because I didn't even know they existed, to be honest.
I was in the same boat. So it started, man, a long time ago, my journey. It started in 2015. I remember finishing up my degree, and I remember I went into my lab the day after Christmas, December 26th, and it was me, one grad student, and a couple of one in the postdoc. And I was looking there, and at this point I was like, I'm gonna do research and do industry work in industry as a chemist. And I just remember sitting there and looking around to my guys, and I was like, this can't be my life. Like this is the only thing we get to do, just do experimentation and interact with the same group. So my preceptor at the time suggested that I look at medicine. She said, Eric, you like presenting data, you like talking about your results. You don't typically strike me as your typical lab rat, is what she alluded to.
So from day one, you were just kind of like a data guy.
Oh yeah.
You're not. Oh, yeah. You weren't medical at all. You never thought about going medical.
At that point, no, I really didn't, because I was like, I really like science, and medicine really didn't interest me at that point. I would say it was something I was drawn into. So she suggested, hey, there's a thing called scribing. How about I get you in contact with somebody? And then one thing led to another, did some Google research, and at the end of 2015, I got cleared and started the program.
So what does that all entail then? Once you actually decide you're going to be a scribe, is it a school you go to?
No, well, you do have like on-site training, so I call it scribe school. But really, the first part of it is can you type? Can you take notes? How good is your attention to detail? The other factors that I would say would make a good scribe would be, what is your end goal? Scribing is not a end-all, be-all career. I really hope it's not. Typically, most of us either go to med school or PA school, nursing school. During my time as chief, I sent, and my partner sent 30% of our entire staff either to med school, nursing school, or PA school. I wish I had my numbers from back in the day. But
so it's not something people typically stay in forever?
Oh, no. Absolutely
Do
not.
they, though? Do people exist out there that are going to be a scribe forever?
The forever scribe, as they're called, I don't think they really exist, because honestly,
it's a stepping stone?
Oh, yeah. It's almost like volunteering or like a prereq. It's almost expected. In 2015, it was probably unheard. Very few people that applied to medical school and got in were scribes, and now vast majority, I would say greater than 75 or 80% of all current medical students were scribes or had scribing in their past.
You're making a living off of it, though, right?
Oh, no. For me, this is I wish I could say that, but I enjoy it. So the pay is really secondary to it.
Is it?
Yeah. Oh yeah. We start off. I don't even know if I could talk about this. We can start off.
You don't need to say anything if you don't want to.
It's like barely above minimum wage. So
it's not something that anybody goes in. They're like, oh, I'm just going to stick with this, and I can make enough money to live, and that's all right.
Absolutely not. I mean, the speech I gave to all new orientees, I would say, if you're looking for a job that makes money, I can't recommend this. You can make more money at stocking boxes at Walmart, paid $15 or $18 an hour.
Mm-hmm.
But this job is a good way for you to get introductions to many specialties. ER is gateway to many things, and I'm like, this is a stepping stone for medical school, PA school, nursing school. Don't get me wrong. I've also had some subspecialists some scribes go into optometry. One completely killed the interest in medicine and went into something computers. I can't remember, but he literally said.
So he was like, "Oh, this medical shit's not for me."
Oh, absolutely, yeah. He was like, "This is what they have to do," and he had to. Yeah, I
they have to put fingers there.
Yeah, you have to do what to that guy's rectum? What? No, exactly.
What have you all done to rectums, by the way? Now that we're on the subject,
we're non-clinical, but I have seen things. I have truly seen things.
Let's get into that.
The best story I have, as far as like rectal foreign body, is like 2016 mid. Let's see, what's this guy in the 50s? Mid 50s, and came in like sometime after Thanksgiving, between Thanksgiving and right around like the panic of like shopping for Christmas, and he came in with rectal pain. over the last 3 days. So he wasn't necessarily forthcoming. We're like, did somebody injure something or whatever? He's like, it just hurts. So they said, okay, we'll do a digital exam, finger exam. And my provider at the time did the thing. He's like, this feels very odd, very smooth. This is not normal.
This doesn't feel like a normal one.
Yeah, it just, the tone's wrong. It's cold for some reason.
Cold?
Yes. I'll get to it. But
okay.
They said, we'll get an X-ray because you're not being forthcoming. Like, and he's like, do you do any drugs? Do you do any drugs? The guy's like, no, I don't do any drugs. I don't do any drugs. Did somebody do this to you? And he's like, no, I didn't. No one did it to me. And we get the X-ray, and on X-rays, only certain materials show up on an X-ray.
Mm-hmm.
Glass does not show up as a...
Oh, shit.
Does not show up as... There's a word for it. I wish I knew.
You basically can't see it? It's just transparent?
It's transparent. You look through it, but it had a very distinct shape. It was about, yay high, and there were 3 of them, and they flared at the mouth, you see.
What?
So ended up getting a call from the
What do you mean by yay high, first of all? How big are we talking here?
Yay high, about that, yay high, and
the size of the top of the bottleneck?
Little bit bigger.
A little bit bigger than a bottleneck.
Yes.
So like the base of a bottle, maybe.
Probably... Well, let me just describe. Maybe you'll have it instantaneously.
Okay.
We get a call from the radiologist saying, what happened to this guy? Like, his tone is very odd. There's very distinct marks. And the radiologist says, my best guess, doc, is like, this guy has like 3 shot glasses in his rectum. And he did. And he didn't have it the way you would expect. Like the tapered end going first. No, it was the big end first. The problem with it was there were 3 in a row, and they had enough liquid between them, causing it that suction pressure. So you couldn't pull one because they were all...
Oh, shit.
So he ended up going to OR later. But I was like, is this normal? And my doc was like...
We're doing shots.
Yeah, yeah. So just imagine that. And
oh, man, there's freaks out there that do weird shit. Why don't they ever admit it? If you're that crazy enough to put shot glasses in your asshole, just admit it. You would think you'd be nutty enough that you're not going to hide from that or shy away, right?
It's probably a pride thing. I think a little bit degrees.
I get it, because I would never admit that, but I would never do it in the first place.
My advice is go to an ER where no one knows you. So,
man, I just don't know what's going through people's heads, because we've all been in a point in our lives probably where we're like trying to meet up with some chick, or we're feeling a certain way, but does shit like that ever cross your mind?
All the time. I mean,
shot glasses?
The shot glass thing never did, but I'm just like, A, the big hospitals, I know too many people, and B, I don't even think like the tone would ever come back. I wonder about that, So, no, never crossed my mind. But that show, Sex sent me to the ER.
That's a show?
Yeah, it really is like... That's life.
So your specialty is in the ER?
Yes, I only do ER.
You only do ER. So how many of those, if you just ballpark a percentage, are sexual related ER visits?
I have shot glasses. I have a squash. I have an Aunt Jemima bottle. I have...
See, those make more sense. The squash makes more sense than 3 shot glasses.
Man, I have a lot of weird things.
Yeah.
To say. A lot of...
Any live animals?
Ooh.
Like a gerbil?
Okay, like those kind of animals, no. But I've had people try cockroaches. They've tried things like that. Very odd. They, yeah. I don't put things that don't do. Luckily today, I had a normal one. Had a child come in with a complaint of foreign body in the left ear. It ended up being that his friend stuck a pebble in his ear and.
Nice.
Yeah, it was funny. He was
that sounds like a good idea. Let's do that.
Oh, yeah. And he was hush-hush about it. He was like, no, I was at recess, and I fell, and this rock just, like, landed perfectly and got into my ear. And, it was
I'm sure you hear stories like that all the time where even, like, the dude that had the shot glasses in his ass, a common response would probably be like, well, I was walking around the kitchen, and I slipped and fell, and they just went in my ass. I don't know how.
That reminds me of another one. Like, it was like, well, this is a while back. It's probably a couple of years ago. But a guy comes in. He had multiple stab wounds, and I will never forget it. Never forget it. The look on his face. He's like, yeah. So he had stab wounds, 2 on the back and like 1 on the abdomen. So he was going to be upgraded to a trauma. And I'll never forget the answer he gave my doc. He's like, how did this happen? Did you get assaulted? You know, whatever. He's like, no, doc, like I was just unloading my dishwasher and I had like wet hands and I picked up my kitchen knife and it like slipped out of my hand. And then it, like, you know, I was reaching over and it poked me in the abdomen. And then it was like, well, I guess, but how did the ones in the back? He's like, you don't understand. It was wet. My hands were wet. I slipped and I kept sliding my back against this knife on the ground. And he's like, sir, we're going to take care of you. We're not the police. Yeah, we're not the police. But, and he says, that's the story. I'm sticking with it. And he looked dead at, you know, like my doc. He's like, that's the story I'm going with. Please.
I'm dying on this hill. Yeah, that's what happened.
Yeah. Fantastic.
It's like the magic bullet that killed Kennedy, right? That went through Governor Connolly like 10 times. That was the same thing with that magic kitchen knife.
Oh, man. Wasn't that an Angelina Jolie movie, Wanted? Or wasn't it the way they curved the bullet? I forget about that.
That was... Oh, yeah, I know what you're talking about.
Yeah, I can't... Man.
It's not the Matrix.
No.
But where they, like... They have the handgun.
Yep.
And they sling their arm, and the bullet goes around them.
Yeah.
I think they actually tested that on Mythbusters, and I don't think it's possible.
No. It has a follow... Remember... projectile motion follows that like tangential rule.
Yeah.
Like unless it's held by center mat, you know.
Yeah. Damn. So cockroaches. Let's go back to that real quick.
Oh no.
Tell me that story.
Oh no. That one's I can still smell it actually.
Oh God.
You know, it's
what was the smell?
Everyone has their weird smell. Like
yeah.
Some people it's vomit, some people it's like feces, some people it's urine. For me, it is definitely feces, and I don't ever call that. I like the prodding, but I don't like that one.
Is that a traumatic memory for you?
Oh yeah, something I wish not to relive.
Well, did you ever get COVID?
I've had COVID twice. So
did you lose your smell?
No. Never had that.
Really?
Never lost my smell.
Because I have an uncle who lost his smell, and he regained most of it back, but he still can't smell feces. And he considers it a superpower. He's like, yeah, I can fart all day in my car, and everybody gets mad, but I'm like, oh, I don't smell anything.
That is That's fantastic.
Yeah.
So it's just like that odor or anything else.
It's just that specific odor. Yeah. It's really strange.
Yeah, that's an odd one.
Yeah.
Oh man.
It's too bad that didn't happen to you.
No, like I said, luckily for me, I had COVID my first time in 2021.
Mm-hmm.
I was completely asymptomatic. Only reason I knew is I try to donate platelets every week, and they ran my test. Like, Mr. Wong, did you ever have, the COVID vaccine? At that point, it wasn't required. I said no. They're like, well, you have antibodies to it. I'm like, how is that possible? And they said, well, either you had COVID or the vaccine. So I had them rerun it. Came out positive. I had completely asymptomatic. It was one of the small rare cases.
Yeah, the taste and smell one is a weird thing. That's something that's pretty. It's not very common in other viruses.
Yeah,
I've never really dealt with that.
Yeah, and they're sad. one of my nurses actually never regained her sense of taste and smell.
Really?
Yeah, and she had a beginning of COVID onset, like early 2020. So
that would drive me
weird,
crazy if I couldn't
right?
taste food.
Yeah, she joked at the beginning. It's like I lost all this weight, but she never can regain it. It's very odd.
Yeah,
There's therapies I heard.
It is strange. That, so. I mean, for somebody that hates the smell of feces, though, it might have benefited you, right?
I think worst smell would be feces, and the worst sound is vomitous retching. That sound kind of
somebody that's vomiting.
It's kind of that like sound right before it comes up. So yeah.
You wouldn't like to hang out with me on the weekend.
Oh, I like much rather hang out with you on the weekdays.
Yeah.
Cheers.
We'll take it easy. Yeah, cheers, man.
And thank you again for providing the excellent.
Oh, for sure, yeah. So. I provide it for everybody that comes on. Thanks for coming on. It means the world to me.
Yeah, like I said, I listened to a couple of them. I wish I had more time. I was just busy, short turnaround, doing the time I scheduled and the time I had, but I really enjoyed them.
I appreciate it, man. Yeah. It means a lot. So when you're in the ER, are you just hanging around the doctors the whole time then, or are you actually like out there when people are coming in taking notes?
So really, we typically follow just one provider, be it a doc, an AP, or the PAs or a nurse practitioner. But pretty much we hang out with them all day, and that is what really makes it worth it. Is because you get to ask him, "Hey, tonight I worked with Dr. Maddox. Dr. Maddox, like, what was your med school like? What was applying it like? What were some of the interesting cases? Why did you choose emergency medicine?" Cannot.
Those firsthand conversations are, yeah.
Cannot. I mean, you cannot put a monetary value on them. They are invaluable, and everyone has a great story. I mean, for the ER, especially, like, we had people trained on both coasts, West Coast, East Coast, different styles, different generations. It really is a great way to see if you know,
just to
want
get your
go
foot in
through
the
it.
door.
Oh, absolutely.
And then once you're immersed in that world too, you make all these connections with people, and you're learning exactly what their daily life is like too. You're basically job shadowing
Oh, absolutely. Yeah.
while you're making a little bit of money and taking notes, right?
Yeah, absolutely. And like you said, two of my former scribes, they went on to become, they went to PA school, became physician assistants, went to school, became PAs, and then got the certification, came back as medical providers in the ER.
Really?
So started as a scribe, then graduated and went to PA school, graduated.
Those are the
came
ones that
here.
probably treat you the best, right? That have been in your position.
They know. They know. They're like, I remember what it was like to be at the bottom of the totem pole.
So that being said, what are your goals? Do you have some big goals to be a PA or a doctor?
So my goal is medical school. So this whole rigmarole this last couple of years, especially with COVID and everything, is really solidified my opinion of what I want to do. I always say I don't have the heart to do ER. ER is a little bit too fast-paced for me. Anything you can imagine, from single, like I stubbed my toe 3 years ago and I'm coming to see you today, or man, I'm having chest pain. Does this look like a heart attack to you or sound like a heart attack to you? Yes, I would say medicine is for me. I kind of like either the family practice route or kind of like, or maybe I'll specialize in like geriatrics. My mom and dad always said, like, you should learn how to take care of yourself. So we all get old, so we might as well learn how to do that.
Yeah, for
get
sure.
paid. So
For sure, man. So you're one of the success stories then out of all the scribes. You
I'm
kind of
hoping
went
so.
into it, never thinking about going medical, and now you're like, yeah.
like you said, it was a good introduction to a lot of things, and I can see myself taking
You don't
the
really
school.
get queasy about things at all? Like seeing a bunch of blood or anything like that doesn't bother you?
No, honestly, like my first year, I got to see a thoracotomy in the trauma bay. Rollover embassy didn't have the smell that I thought it was going to have. Of course, low totem
You're a
pole
big
guy.
smells guy, aren't you?
Smell highly associated with memory, so that's
It
my
really
go-to,
is, yeah, it
but
is.
I was in the very back, but I will never forget that sight, watching the trauma attendings and the surgeons, and it was very interesting. Like that's this guy's heart. Hey, there's his lungs. Like, whoa, that's not what I expected.
It's pretty wild.
Yeah.
A lot of people can't handle seeing that stuff. They're like, oh, shit. That's
Yeah.
what my insides look like. Oh, no.
Yeah, and they should be inside me, not outside. You know.
Right. Yeah. Well, maybe if your smell was gone, or if you plug your nose,
Oh man,
would anything bother you if you couldn't smell?
I would.
As far as medical goes?
As far as medical, yeah. Well, no. I mean, smell typically. Well, that's so hard. I guess you kind of have to take people's word when they say my urine smells. Like, you can always document that on an exam.
Shit.
Like, patient reports malodorous urine. You know.
That's not something I want to be involved with.
Yeah. Typically, we don't measure smell in ER. That'd be like ENT more likely. So,
Have you ever seen any? I don't even know why I'm asking this, but have you ever seen any ER visits where they've shoved something in their urethra?
yes, toothpicks is very common.
It's very common.
very common.
What? What's the point?
I know this is only going to last like roughly 45 minutes to an hour, but I could tell you stories for days. But yeah, toothpicks are very common, especially in young adolescent males.
For what reason?
The best.
Why would anybody ever? It makes me, want to clench my knees just talking about it right here.
The best response I got was from like a 13 or 14-year-old that said, "I just want to stay the same size all the time." That's why he thought that. Yeah.
Aren't there other ways to do that?
Poor kid.
Oh, man.
I know.
Yeah.
Poor kid with his mom. So.
His brain needs to develop further. He's going to
Yeah.
look back at that.
Oh.
I'd be
We're
so
all-
embarrassed if I went to the ER as an adolescent for shoving something in my dick hole.
Oh, yeah. He really did. He's like, I don't want it to go back to it. Just.
It's supposed to go back. It's not supposed to.
More drink.
Yeah, more beer. Oh, man, this is getting really weird.
Yeah. Oh man.
What are some other crazy stories? Let me ask you this. What's something that you found out that people do that is fairly common. I mean, besides the toothpicks and the dick holes and shit like that, that you never ever thought about before? Like I didn't even know this was a thing.
Oh man, I mean, when the rectal foreign body things, like squash, okay, Aunt Jemima, I guess.
Aunt Jemima.
Yeah, it was the one with the old. Well, I'm sorry, wait, that's not PC anymore. Isn't it called like Old Country now?
Yeah, Aunt Jemima got canceled.
Yeah, it got canceled so hard. But like that, I don't understand it. Like, I don't mean to like kink shame anyone, but that's some odd stuff.
Yeah.
Like, oh no.
Especially stuff that's not designed for that, because you can go to a sex shop and buy stuff that's literally made to go in your rectum. As fucked up as that is.
Yeah. Oh yeah. But they choose to. You know what? I have this carrot, or I have an Aunt Jemima bottle.
Get
like,
this carrot.
Yeah. Oh man. And I guess I swear, like there was. Like the biggest cucumber I've ever seen. I'm like, this would have been great on a salad, you know? And just gonna throw this away now.
Somebody else thought it was great for something else. Yeah. So do you see some pretty traumatic injuries too then that come in there?
Yeah. Oftentimes, if it's like you say, super traumatic or like considered a trauma, they bypass ER, go right to a specialty team called the trauma team. But I have seen roller accidents in what do they call four-wheelers. Oh, it's so sad. Like a 10-year-old, I remember a couple seasons ago, he was like learning how to be in an RV, help with his dad. They hit something, he rolled over. His hand was on the outside of, they call them grab bars or whatever the outside cage thing is. It rolled over his hand, and I will never forget the screaming. I'll never forget what that hand looked like. There were angles that, and I felt bad because 10-year-old had a lot of growth plates. 10-year-old, so I always wondered how these cases
end up in the long run.
Because again, we either in the ER we either admit them, discharge them, or transfer them. In this case, he was probably, I can't remember, it's been a couple of years, but he was probably discharged home with pain medications, followed with hand surgery or orthopedics. But I always wondered how did it turn out? I'm hoping they got the growth plate, because if not, he's gonna have
a smaller hand.
Yeah,
it's gonna be jacked up in some way.
Yeah, I'll never forget that. Or other ones, the loss of a child, the mother's cry. So
it's pretty traumatic working in the ER.
Yeah,
you could say
There are things.
Is that something you were prepared for?
Absolutely not.
No?
There's no good way to prepare for that.
Yeah.
And the other one, the story, like I had beat cancer so many times. Like I beat it. I was on chemo and radiation therapy, but like 3 days ago I started having abdominal pain. Of course, in the ER we're going to scan you, and when they just light up on the scan, when the doctor's looking at the images, and we're just like, oh crap, like I'm gonna have to tell this guy his cancer's back, or this lady her cancer's back. Like she rung the bell and everything, and the tears in those are real. And then you can see the stages of grief, like bargaining, depression, like.
So if somebody's gonna work in the ER, they need to be prepared for these kinds of things, right?
A strong constitution for sure, and even tougher skin, I would say.
Yeah.
So one of the more traumatic things that happened to me a couple of years ago, like right when I was new, and I was at St. Joe, and which is shouldn't be considered a psychiatric hospital, but it kind of is. This guy comes in, he's an elderly gentleman, and I walk in with my doc, and I close the door. The guy has a Vietnam flashback, and he jumps out of the bed, pulls out the IV, the blood pressure cuff, and he almost gets his hands around my neck.
No shit.
And I honestly, if my doc didn't like push him to the bed and get him calmed down, like this guy would have, because seriously, just complete Vietnam flashback.
Oh man.
So it was frightening.
Yeah, that's rough. That's tough to deal with too, because a lot of times those guys won't stop.
No, they go after you, and small room too, so the door was closed, and that was probably a mistake.
It's probably something you never expected being a scribe.
No,
thinking
absolutely.
You're just going to be taking notes the whole time, and then you get into a situation like that, and it's probably like, I didn't sign up for this.
Yeah, exactly.
You know?
You're right. I mean, again, get the camaraderie. You get to talk to the doctors and ask them about advice. And hey, I've known you a couple of years, like Dr. Chang. I've known you for a couple of years. Would you mind writing me a letter? Like, that's what you think, and I'll do your paperwork on the side, but not.
The reality is that if you're in the medical field, you're dealing with this stuff, whether you're a scribe or a nurse or a doctor. I mean, no matter where you're at on the totem pole, you're still dealing with these people that are in probably some of the worst situations they've ever been in their life.
Truly, like they say, like you said, they truly feel it's an emergency. That's what the big red sign is for, and I want people to come in.
And yeah, that's crazy too to think about, because people obviously consider things emergencies that other people wouldn't, right? There's a lot of people that show up that probably don't need to be in the emergency room, that are either like hypochondriacs or they're just freaking out. It's the worst thing that's ever happened to them, and it's really not that life-threatening.
Yes. The worst ones are, typically right around Thanksgiving, like everyone's family's in town, like, Uncle Joe, you have this bunion, like you've had it for a long time, and we think you should go get it checked out. I mean, I remember another case years back. Guy came in for a splinter that had been in place, lodged in his one of the thumbs. I can't remember. It's been a long time, but it had been like 6 or 7 years.
Oh God!
And we asked him like, why today of all days? He's like, I was rubbing it, and it was irritating. It just that little thing. It just never came out. Like, isn't skin supposed to like push it out? It was like 6 or 7 years, and I remember writing that, and it's like, so
it's crazy.
Yeah.
Yeah. One thing, if there's anything that I've learned from talking to all the people in the medical field that I know, it's that if you think there's something wrong, you should get it checked out. It's probably, I mean, even though it's frustrating to see people come to the ER probably that are there for a stupid ass reason, shouldn't be there at all. But at the end of the day, isn't it better to do that than to not come into the ER because you think you're going to tough it out?
Exactly. Like I said, the biggest advocate for your own health has to be you. You can't rely on your parents or your spouse. It has to be you at the end of the day. So if you feel like you need to be evaluated, ER open 24/7, 365. We're here. I mean, we'll see it.
Yeah, and we thank you guys for that. Cheers to you guys for doing that, because that's a big responsibility to hold, to be there all the time for everybody.
Gotta be.
How comforting is it that you can I could right now pick up and go to the ER, and there's going to be people there that are going to assist me immediately. That's a badass. People take that for granted.
I wish it was as good as you said, immediately. I mean, during the height of COVID, we were having like really long wait times. We will for sure get to you. Absolutely. No doubt. It's just the overwhelming volume. So many COVID patients. But the nice thing about that is most people are vaccinated, and they don't have to be admitted. They just kind of get like a reassurance, and then we do a couple of labs, maybe a chest X-ray, and like we think you can go home. Just sometimes it's just being told that is enough for people.
And on top of that too, there's probably several people that you see just that are repeat customers, if you want to call them customers or whatever, but they're always in there.
Yeah, this is before me, but there was an event at St. Francis. One of the patients, long time, they celebrated his 100th ER visit with him. They got him a cake and everything.
Are you serious?
Yeah, I can see the picture in my mind's eye on the refrigerator in the break room.
I can't believe they didn't resent him.
Yeah. Honestly, if he really felt like he needed to be there, I'm glad he got the care that he needed and got. It's funny, some of these repeat patients like you describe, they have better health care than me or you, honestly,
True. At that point though, after like 100, it's got to just be more of like a reassurance type of deal. Like, just tell me I'm good again so I can go home and sleep,
Yes.
They're probably anxious as fuck, and they're just like, they need somebody to tell them you're fine.
Yeah. And like I said, sometimes all they need is that simple reassurance. I mean, don't get me wrong, there's also like a homeless population, especially downtown in St. Francis, especially with the snowstorm. They would just, hey, guy comes in, no room in the shelter. I'm having chest pain. That will keep me here for a couple hours, right? Warm bed, right? Okay,
Yeah, that's the unfortunate reality. So tell me about this. You're talking about all these different hospitals, St. Teresa, St. Joe, St. Francis. What's your schedule like, and do you get to make it?
Okay, so typically Schedule, as far as like the Via Christi system goes, as far as my company goes, we work at all 3 campuses. So, like I said, St. Francis, St. Joe, and St. Teresa. My schedule was a little bit, what's the word? A little bit more preferential, just because I used to be the chief. I used to be chief medical scribe, and one of the privileges I gave myself, or I earned at least, is once I step down, I kind of get to pick my schedule. So to answer your question directly, this week I started Monday, I was at St. Joe. Today is Tuesday, I was at St. Teresa. On Wednesday, I'll be at St. Joe. Thursday, St. Joe. Friday, St. Francis. So I try to work at all 3 campuses, just to get a good, balancing as far as that goes.
So do most scribes work Monday through Friday?
That's the thing. Most of the scribes they're in school. So we have 3 different kind of criteria of what their status would be. Most scribes only work about 17 hours, or what we call per diem, per week. So that could be like 1 or 2 shifts, and it's basically on them. ER never closes. We have shifts from 6:30 in the morning to 6, like all the way around. So
if you're on the low end, just trying to work, 17 hours or so, you could say, I'm in school this, and this day, so I'll take an ER shift on Thursday.
Yeah. Oh, yeah. Very flexible.
Very flexible.
This is something I did during undergrad. Highly encourage it for people that are interested in medicine, because especially ER. I know that there are scribes out in the family practice clinic, orthopedics, plastics, radiology, or not radiology. What is it?
Optometry?
Oh, not optometry.
I know you mentioned that earlier.
What's the other clinic? I know there's another one in town. I think it's radiation. No, I think it has to do with the oncology, something like that. But they have their clinics, of course, Monday through Friday, weekends off. But they want scribes that can be there up to 40 hours.
So you can be a scribe outside of a hospital setting too.
Absolutely. Yeah.
You could be at a normal family practice. Okay.
Absolutely. Yeah.
So these are just positions you apply for. And they most of the time know that you're a student, probably. So
absolutely, yeah. I mean, most of the time these are students looking for like just a little bit of extra cash, or trying to see if they like medicine.
Yeah.
Or not. And actually, to add one more point to the prior subject, is you can even do telescribing. So one of my scribes on staff, she telescribes for a Massachusetts company and an Iowa company. I have to ask her. She does it remote.
Just remotely.
Yeah. She watches like
chills
teams.
At home and takes notes.
Exactly. I always wonder about that. She just does it, and she even did it when she had COVID. She couldn't come
physically,
but she did it. It was amazing. I mean,
shit, man, technology is a cool thing.
I mean, don't you just love Teams, and don't you just love
it
like
is pretty
Zoom?
Useful.
Yeah,
not gonna lie.
Yeah.
So there's 3 tiers. What's the second tier?
Oh, I'm sorry. Tiers as far as like hours. So you have your
like hours. Yeah.
So part time, full time. Yeah.
So chief would be a full time.
Chief was full time. So for me, when I was chief, I worked about 30 hours per week, and my primary responsibility was making the schedule. I've always loved puzzles, so designing a schedule from people's preferences was awesome. I loved it. There'd be a couple of times where a month would be pretty crazy, but I would just listen to, if I got really into a pickle, I'd just listen to Rod Sandstorm just over and over and over. And
Sandstorm?
Yeah, I would listen to that. Yeah. For like hours until I finish it, because I couldn't figure the puzzle out. I'm like, I gotta get something. So yeah, dance music really worked for me.
No shit.
Yeah, that was my go-to.
Well, right on, man. So you said that you're not a chief scribe anymore.
No.
Why is that?
So there's a certain point that at the end I was kind of burnt out. At that point, I had just worked. Man, I had worked like, I think I looked it up. It's either 273 or 274 days straight, constant. Every day I worked.
Really?
Be it emails, meetings, being it administration, doing schedules. It was an insane stretch of time. And
being a chief scribe.
So Via Christi's a larger program for ER. So we have 3 of them. But one of my partners at the time, she just had a baby. My other partner went on vacation, and then just a lot of time just developed, and things have to be done, things that you wouldn't think about, just being a boss. But yeah, my longest stretch of time doing work every day, even if it was like 15, 20 minutes, was like 274 or 273 days straight. And it's kind of...
Wow. Yeah. So...
I remember answering emails on Santa Monica Pier. So
7 days a week, full 8-hour shifts?
Not always. Like I said, some days would be like 20 minutes or 30 minutes at a time, but sometimes, or
some of the days you're just showing up for a meeting or something like that.
Yeah, or some of you get locked out of some of the credentials didn't get caught through, and I get a call like 4 in the morning, and then I have it varies. Like I said, when a place never shuts down, you're going to have problems somewhere.
How do you become a chief scribe?
Oh man, it typically is somebody that wants it more than anything. It's something that you can put on a CV, and honestly, I really wanted to see in any job I've ever had. I want to see what the highest position I could obtain, and as far as the local level, I did that. And after the challenge kind of done, was complete, and I was satisfied with that, I could step down. So nowadays, I don't work nearly as much. It's just to keep, active, something to do.
Okay, cool. So when are you in medical school already?
No. So right now, I'm still in the application phase. My last interview was in December. So about March or April will start. That's when the wind down gets. So hopefully, I get a letter. My top choice is going to be my top school is going to be Creighton. I liked campus.
Really?
Yeah. Plus, like I said, Nebraska and Omaha still has that kind of like Midwest feel.
Yeah.
Born and raised here.
Yeah.
I'd rather not move out of that if I can help.
I feel you, brother. I feel you. I don't want to leave it either.
Yeah.
It's a good place to be.
Yeah.
It's a cheaper cost of living, and people are friendly.
Yeah.
I totally understand. I hope it happens for you. You seem like a brilliant dude, honestly.
I don't want to get my head too big, but you learn so much, and that's one thing I want to say. Just as far as that goes, you could always learn some more. That's why being a physician is you're always a lifelong student, and that is a occupation I can really see myself behind, and I want to just try to do some good.
And you think being a scribe was extremely important in making that decision?
Absolutely. It opened my eyes to so many things. Most people see docs, they think of the cars. I mean, they think of the lifestyle, they think of the houses, they think of the vacation and all that stuff. But you have to remember 4 years of undergrad, 4 years of medical school, 2 years of, depending on what you want to do, residency, fellowship. It's a long path.
It's a long path. Yeah. If you start at 18, I mean, you're in your 30s before you actually start to reap the benefits from it.
Oh yeah. And then
that's another thing too, is there's a lot of people that do get into it at 18. They know what they're going to do. Which is kind of crazy, right?
Yeah. It's crazy. At 18, I was like, oh, no, I'm not mature enough for this. Like, how could I, I'm going to be in like a short, like at 18, I'm like, in short 10 years, I'm going to be, saving people's lives. Like,
in one short decade, I'll be doing what I want to do.
Oh, I couldn't.
That's why that's another reason why it wasn't for me. One, I don't like dealing with medical stuff at all. But secondly, just the amount of school, like I couldn't wait to get out of high school. I was so excited. I was like, I don't have to deal with this shit. Show up, listen to teachers, I don't know. I was just a dumbass kid, but
and like you said, also like the egos on some of your teachers. These, they often say like doctors have like this God complex, and sometimes that's sometimes true, sometimes it's not. But think about it, they can literally have a person that coded or has like a abnormal rhythm or lack of rhythm, and they can bring him back. I mean, after a certain point, you're like, I command this. I know the science so well. Like, I brought this person back on the brink.
It's pretty crazy.
They think that, but then everyone knows it's the nurses. If the nurses don't have your back, you're not going to get anywhere.
Yeah. Jared Smarsh, episode 8, registered nurse.
I will be checking that out.
Yeah, check it out. He would love what you just said there.
Oh, that's if you ever get anyone else that comes like from the medical field and they say anything contrary to that, call them out, because I'm
going to do it. I'm going to say Erik Wong told me.
Exactly.
I'm calling you out, motherfucker.
I'm hoping you do, and then I'm like, yeah, he's a first year now or second year or whatever. Yeah, like he said it himself. So
yeah, and maybe by then you'll be a doctor too. So they'll really have to be like, okay.
Oh man.
You never wanted to be a nurse though?
That could be do a lot of good. That's the question that everyone has to ask themselves. And like I said, I have 7 scribes that went down that route. It's just for me. When I look at schooling and everything, at the end of the day, I kind of want to be the one that solves a problem.
Right.
And nurses do it all the time. It's like, I love it when the new residents come down and they're like, they order all these weird things, and the senior nurses that can run a code by themselves, like, are you sure you wanted that? This seems like a very low volume, or like this seems like an abnormal amount. And nurses, Absolutely. Cannot go to bat for them more. But for me, at the end of the day, I kind of want to be able to acknowledge, yes.
Your brain works a little bit differently.
Yes, I am a dumbass. I'm new. So I'm going to believe you. But I also want to make the final call as far as that goes. I kind of like...
You want to be the puzzle solver.
Exactly.
Yeah.
I would love to do that.
Which is what the doctor's doing at the end of the day, right?
Yeah.
He's kind of solving the puzzle.
Especially clinically. I have no interest in surgery. No one gets up, especially as a kid, saying, "Oh man, I can't wait to grow up and cut on people." Like, no one says that.
Except for Jeffrey Dahmer.
Well, you always have your rare cases. You're right. You're right.
Well, we used to play Operation as kids, though, right?
So fun.
Yeah, that was a good game.
Oh man, I think I hit that too many times, and the little bulb in his nose ran out. So.
Alrighty, man. Well, do you have any last advice for anybody that wants to be a scribe or get into the medical field at all or anything like that?
I would say if you are really interested in, medicine and you're looking at PA school, nursing school, physical therapy, maybe not to a degree, well, a little bit. I would highly encourage looking at the Scribe program. It's very flexible. It works with your schedule. We could always use more people, and it's a good way to see if you really enjoy it. Like I said, I had a Scribe in the past say, you know what, no medicine for me, I'm going to do computers. Or I had a couple of people went into dentistry. That's probably smart. That's really smart.
Being a dentist?
Yeah.
And an orthodontist?
Oh, yeah.
Yeah.
And their boats have other mini boats on them, and they only work Monday through Friday.
Right.
But no, I mean, I guess my final closing words would be like, look at scribing as a really serious thing. And I guess the last thing I want to do is to make this time-stamped, I guess, is if you can, donate blood. We are in a very, very tight circumstances with blood. So if you can, Red Cross, please do it. We really do. And surgeries are getting canceled. People that have delayed surgeries from COVID time that can qualify for it, they're getting canceled. So I would really...
Give blood, save lives.
Give blood, save lives.
And just a little bonus, if you drink like 2 or 3 beers after you give blood that day, you're going to feel it a lot more. So
absolutely. And then, hey, think about it. It's cheaper in the long run for you to get that buzz quicker.
It's cheaper and you're saving lives.
Exactly. You get crackers after that and cookies. So
hell yeah.
Yeah. So
well, thanks for all you do, man. Stay strong out there. I know you deal with a lot of traumatic stuff, some pretty horrific stories, some also really weird ones, but thanks for being there for us all the time. Thanks for doing it, and good luck on your future endeavors.
Appreciate it.
I hope med school works out for you.
Thank you.
Yeah. Cheers, brother.
Cheers.